Good afternoon, everyone, and welcome to the PQA webinar. I am Lauren Kirk, Senior Director of Strategic Partnerships here with PQA. I'm thrilled to join you to host our speaker from EnlivenHealth in a discussion of a personalized member experience and proven strategies to improve the member experience, adherence, and health outcomes. But before that, let's walk through a few logistics-related items for our webinar. First, please submit your questions during the presentation using the Q&A feature located at the bottom of your screen. Also, the webinar recording and slide deck will be made available to PQA members within the week following the presentation, and it'll be in the member resources section of the PQA website. And lastly, please complete the quick 1-minute survey that will appear at the conclusion of our webinar. Today's presentation is generously supported and sponsored by EnlivenHealth. Mike Cantrell is the Senior Operations Consultant at EnlivenHealth. He's a registered pharmacist and licensed attorney. He's known for his broad view of the U.S. healthcare system and for successfully driving retail pharmacy performance. During his 30-plus years in the industry, Mike has served in a number of executive leadership roles with Fortune 500 companies. He has expertise in pharmacy operations, managed care, regulatory oversight, pharmacy mail order and central fill operations, community pharmacy marketing and procurement, specialty pharmacy, and state and legislative affairs and government relations. So Mike, thank you for joining us today. I will hand the virtual microphone over to you.
Great, well, thank you, Lauren, for that kind introduction, and hello, everyone. Well, today, we're going to look at a few ideas of how technology can facilitate some improvements in your organizations and among your members or patients. Now, as Lauren said, I'm a senior operations consultant with EnlivenHealth, where I'm responsible for identifying needs within the healthcare continuum, then engaging the appropriate experts to craft possible solutions to address those needs. So let me tell you a little bit about EnlivenHealth. Next slide, please. So EnlivenHealth develops software solutions designed to identify certain members or patients based on those members' clinical and behavior history, then engage those members to improve their health. Now, we're a division of Omnicell Inc., which, by the way, will be celebrating its 30th anniversary this year. And we recently combined with FDS Amplicare and MarketTouch Media to yield what we believe to be the industry's most comprehensive offering of clinical, financial, and analytics solutions for retail pharmacies and health plans. Now, there are about 65,000 pharmacies in the US, and nearly 50,000 of them use one or more EnlivenHealth solutions. We pioneered technology-based medication synchronization and offer the most elegant and effective MedSync tool in the industry. In fact, a patient is enrolled in our MedSync tool about every 9 seconds. And we currently have over 8 million patients in the solution. And about 70% of the patients enrolled in our MedSync tool achieve adherence. And I'll talk more about MedSync in a little bit. But from a member communications perspective, we deliver about 35 million member-patient communications every month. Next slide, please. So, excuse me just a moment, folks. So, Enliven develops software solutions, like I say, to identify certain members. And the key takeaways for today are essentially that we're going to take a look at some of the factors that influence member satisfaction. I think, are we a slide ahead on this, Marjorie? And there you go. So key takeaways for today. We're going to take a look at some of the factors that influence member satisfaction. We'll review some of the methods that tend to have a favorable impact on member experience and clinical outcomes, and then suggest an approach that's designed to improve that member experience and the health plan's quality scores. Now, let me do this. So let me preface my remarks with some observations that I believe are relevant to this discussion. In 2015, MACRA that is the Medicare Access and CHIP Reauthorization Act, was signed into law. And the important takeaway with MACRA is that it fundamentally changed the provider payment construct. It put into place three important changes to how Medicare pays providers who deliver services to Medicare beneficiaries. First, it implemented a permanent doc fix. Secondly, it created a new framework that rewards providers for giving better care, not just more care. And it combined several legacy Medicare quality reporting programs into one new payment system called the Quality Payment Program, or QPP. And third, it established two Medicare reimbursement tracks: the Merit-Based Incentive Payment System, or MIPS, and the Alternative Payment Model, or APM. Now, why I'm mentioning this is because the passage of MACRA marks a significant event in the evolution of U.S. healthcare delivery. It establishes the foundation of a value-based system that relies on certain metrics intended to measure the quality of care, and consequently impacts the way stakeholders interact. Now, MACRA not only shifts focus away from quantity to quality, but it requires proof of performance over time against defined goals. And these goals generally translate to improved patient outcomes. Now, chronic conditions frequently have complex treatment plans and medication regimen that require a heightened level of patient management. Now, under MACRA, physicians are the quarterback of the care team. But in this group of patients, we're typically dealing with a multi-drug medication regimen. Now, granted, MACRA is limited to Medicare, but I believe it's axiomatic that where goes Medicare, so shall go the rest of industry sooner or later. Consequently, I believe the value-based concept codified by MACRA and grounded in quality will be adopted throughout the entire industry. So you'll see a quality of care is a theme throughout this presentation. Next slide, please. I think maybe one back, Marjorie. There you go. So, as I mentioned, our goal is to find opportunities to improve the U.S. healthcare system and deliver value to our customers and their members or patients. Now, an effective and sustainable effort to accomplish that must consider three factors. First, it has to improve patient access to care. Next, it has to lower the cost of care. And then third, the quality of care can't be compromised. Now, we at EnlivenHealth believe our solutions hit all three of those. Now, our approach contemplates a higher level of pharmacist participation in a patient-centric triad consisting of the pharmacy, the physician, and the health plan. Now, why do we think pharmacy should assume a more prominent role? Well, first of all, access. About 90% of all Americans live within 5 miles of a pharmacy. And according to Drug Topics, patients average 35 visits per year to their pharmacy versus 4 to their physician. As for the quality of care and cost, well, we believe pharmacists can leverage their expertise and these frequent patient encounters to improve patient health and drive down healthcare costs, which of course also benefits the patient's health plan. So frankly, I think the COVID pandemic has done a lot to elevate pharmacy's standing in the healthcare delivery model in the eyes of the consuming public. Pharmacists have administered millions of COVID vaccines and served as testing sites across the US during the pandemic. And I think those activities have served to make the public more aware of pharmacy services that extend beyond the traditional prescription component. But in order for pharmacists to find time to deliver these services, they need to find ways to make their practices more efficient. And that's where EnlivenHealth comes in. We provide pharmacies with the analytics and solutions that drive business efficiencies and enables the pharmacist to identify the patients who are most likely to benefit from a professional engagement. So let's take a closer look at this. Next slide, please. Now, as we consider the various areas that might be appropriate to focus on in pursuit of our stated takeaways, there are two areas that stand out: medication adherence and member engagement. Both of these areas represent significant clinical and financial improvement opportunities, and they're mutually beneficial. By the way, my references to medication adherence also contemplate medication management, and both are necessary in advancing health outcomes. But let's take medication adherence and member engagement one at a time. Next slide, please. So why focus on medication adherence? Well, according to the World Health Organization, medication adherence can have a more direct impact on patient outcomes than the specific treatment itself. Now, this is an industry-wide problem with significant financial and clinical implications, and frankly, medication adherence is a public health priority. Now, it's estimated that 63% of the people on prescription drugs aren't taking their meds as prescribed. 40% weren't taking any of their prescribed meds. And 1 in 5 new prescriptions are never filled. Now, it's also estimated between 100 and 300 billion in annual healthcare spend could be mitigated by improving medication adherence. Non-adherence can account for up to 50% of the treatment failures, about 125,000 deaths, and up to 25% of the hospitalizations each year in the US. Now, we generally consider an adherence rate of 80% is needed for optimal therapeutic efficacy, but it's estimated actual adherence to chronic meds is around 50%. So it shouldn't come as a surprise that medication adherence plays a prominent role in quality measurement scores. In fact, in 2020, those plans that lost at least half a star did so by losing ground on Medicare Part D, which we know is heavily weighted toward adherence measures. And those plans that gained ground did so through a balanced approach in Parts C and D. And just for the sake of keeping the importance of STAR's performance in perspective, in 2020, it's estimated plans received about $12.2 billion in bonuses and rebates and left another $2.9 billion on the table. Now, for Medicare Advantage plans, STAR's linked incentives are a genuine performance imperative. And by the way, Medicare Advantage remains a rapidly growing segment of the industry. It has an enrollment growth rate of about 8% per year since 2014, and it's expected to continue. Now, granted, medication adherence or non-adherence is a complex problem that is affected by a number of factors within the care continuum. And some of those are patient-related factors, some are provider-related, and some are health plan-related. But by having an understanding of the reasons for these breakdowns, we can prescribe corrective actions. Now, patient-related factors include forgetfulness, a lack of understanding of the dosing schedule or benefits, cognitive impairment, a lack of engagement in the treatment decisions, and a number of others, including side effects and improvement expectations. So let me share a quick personal story with you on those last points. A number of years ago, I was at a regional pharmacy chain where I was responsible for managed care and professional services. Now, I was approached by a health plan for whom we served many of its members and with whom we had an excellent relationship. And the health plan was looking to improve its HEDIS adherence scores associated with its members taking certain psychotropic meds. And the literature revealed 2 of the most popular reasons for adherence failures in this class of medications were side effects and the patient's failure to realize improvement within the patient's expected timeline, which was typically a timeline that was much too short to allow the drugs to manifest an effect. So we designed our program to directly engage the member within a few days after the member received their initial prescription and educate them about the possible side effects, benefits, and how long it typically takes for the drugs to start to provide that benefit. And we made that outreach with a live telephone call from our professional services center. The campaign was extremely well received by members, and we did see improvement in the adherence scores. Now, this was at a time when sophisticated patient engagement technology wasn't widely available, so scaling was a challenge for us. If I had the technology that we're talking about today available to me then, that scaling challenge would have been non-existent. Now, to add a bit more to this, in 2020, the AMA published an article that listed the top reasons patients fail to adhere to their chronic medication regimen. Among those were fear of side effects, misunderstandings, that is, the need for the medication or the nature of the side effects and the time it takes to see results, similar to what I just described in our psychotropic program. Too many medications where it's difficult for the patient to keep track of their meds. A lack of symptoms such as hypertension or hyperlipidemia. Mistrust, generally associated with pharmaceutical companies possibly having some influence over physician prescribing choices. And depression, where depressed patients are likely to be non-adherent to the medications that are prescribed to them. Now, as for provider and health plan related factors, inadequate patient communication is frequently associated with low adherence rate. Now, I mention these because they can all be addressed with thoughtful, well-executed member engagement campaigns, which we'll talk more about in a moment. Next slide, please. Now, it probably comes as no surprise that effective medication adherence programs contemplate multiple tactical elements, which should always include a member communications component. So let's just take a closer look at member engagement. Now, patient or member education and ongoing communication are imperative to member understanding, member satisfaction, and medication adherence. Now, according to the 2020 J.D. Power Medicare Advantage Survey, clear, helpful, proactive communications to members is a key driver of overall customer satisfaction. And what that J.D. Power study reported was there are 3 key performance indicators related to information and communication. First, making sure members understand their out-of-pocket costs. Secondly, providing health education. And lastly, delivering useful reminders for preventive care. Now, those 3 things might seem easy to satisfy, but according to J.D. Power, only 15% of the health plans delivered on all 3. And the literature reveals higher patient satisfaction yields higher adherence rates. In fact, a satisfied patient is 1.2 times more likely to be adherent. And if we look at the reasons for non-adherence, where 40% of the patients say they just forgot to take their medications, it makes sense that a communications campaign would be well received and yield improved adherence rates. But keep in mind, there are a multitude of reasons why patients are not adherent to their medication regimen. Forgetfulness is one, but identifying reasons for non-adherence and prescribing the patient-specific engagement is very helpful. Now, certainly, the more data elements we have, the more specific we can be with our patient-specific communications. Taking other factors into consideration, such as health literacy, cultural background, language preference, and proficiency, can all dramatically influence the effectiveness of your communications plan. Now, if your communication effort seeks a behavior change by the members, such as medication adherence, in all likelihood, your campaign will need to be continuous in order for the improvement to be sustained. People tend to revert to their old habits once you remove the prompt. Now, to add more emphasis to the importance of having an effective member engagement plan, just look at the weight CMS is putting on consumer experience related metrics. Now, back in May 2020, CMS changed the methodology for calculating Medicare Advantage quality scores, such that by 2023, about 57% of the total STARS score will reside within the CAHPS measures, that is the consumer assessment of healthcare providers and systems. Now, by focusing on member engagement, I believe member satisfaction and retention can be improved, as will the plan's quality scores and member health. Next slide, please. So It's easy to say an effective member engagement plan is likely to be beneficial, but bringing it to fruition, especially at scale, can be a challenge. Just as I mentioned in my psychotropic campaign a moment ago, automated tools designed to help clinicians identify patients for a specific intervention, then assist with the execution of those interventions, then track, measure, and report on the intervention activities are critically important. Now, the first step is to decide which clinical categories we're going to focus on. At EnlivenHealth, our solutions reside within what we refer to as our patient engagement platform. And what we do is to apply proprietary data processing algorithms to member or patient data to identify those members who are good candidates for our adherence program based on the member's health history. Now, generally, members who satisfy our program qualification criteria have multiple chronic medications in their profile. So you might ask, well, does that qualification criteria exclude a lot of members who would otherwise benefit from the program? The answer is probably not many. The data on this is interesting. 50% of US adults over 45 and 81% of adults over 65 have more than one chronic condition. And patients with 1 to 4 chronic conditions fill between 9 and 24 prescriptions each year. Patients with 5 or more chronic conditions, who make up just 12% of the population, fill an average of 51 prescriptions each year and account for 41% of the total healthcare spent. And because of that multi-drug profile, one of our solutions that we have found to work well in executing an effective adherence program is our medication synchronization technology. Now, as the name suggests, our MedSync tool aligns the refill schedule for those multiple medications to a common date, making it much easier for the members to keep track of their meds and for the pharmacies to monitor their patients. Now, that might initially sound merely like an automated refill function, but it's actually much more than that. Our MedSync solution contemplates an appointment-based model, which is a patient-focused care model that can help patients comply with their medication regimen, avoid problems before the patients arrive at the pharmacy, and provide an opportunity for a meaningful interaction at the pharmacy point of care. In our solution, we incorporate considerable member communications using both direct and indirect methods. Now, the direct methods include face-to-face with the pharmacist and telephone conversations. The indirect methods include automated phone calls, texts, and chatbots. And the appointment component of our solution allocates time for the pharmacist to engage face-to-face with the patient when they take delivery of their meds. And I should also mention that this appointment can be used to provide services that extend beyond those associated with the member's medications. For instance, this is a very good time for the pharmacist to provide a vaccination, making it much more convenient for the member. Now, in addition to the member convenience factor, there's some interesting data on how medication synchronization impacts other facets of healthcare. So let me show you a few data points relative to how MedSync impacts medical spend and med adherence. Next slide, please. In 2018, Harvard did a study to learn if medication synchronization had any impact on patient behavior. Now, this study included 2 regional pharmacy chains, and the MedSync tool that was used was ours. And that study revealed some significant improvements, namely in hospitalizations and emergency department visits, where the declines were 9% and 3% respectively. But the study also found improved adherence for patients with cardiovascular disease, especially those with low baseline adherence. And this study's adherence findings, by the way, are consistent with what our own data reveals, and I'll show you that data in a moment. Now, regarding the cost of care and medication adherence correlation, another study done in 2011 by Roebuck looking at financial impact of medication adherence found annual cost of care in patients with congestive heart failure was estimated to be $7,800 less in medication adherent patients versus a non-adherent CHF cohort. Now, the point is, there are clinical and financial benefits associated with chronically ill patients who are adherent to their medication regimen. And medication synchronization is one tool to help achieve adherence goals. Next slide, please. So what we see from our own data is that adherence, as measured by proportion days covered, or PDC, looks significantly better for medications of patients enrolled in our adherence program across a wide variety of disease states. Now, the center column represents the PDC scores associated with the meds of patients enrolled in our program, while the column on the right represents PDC scores of meds of patients in the same clinical cohort not enrolled in our adherence program. As you can see, there is a significant improvement among the participating patients' medications across all disease states we looked at. Now, you might think, well, with such an increase in medication consumption, the cost of care must also be increasing, which is certainly a legitimate thought. But there have been a number of published papers on that point. And one of those, published by EnlivenHealth in 2018, found that every dollar spent on medication adherence saves $4 to $7 in treatment costs for chronic conditions. So yes, it's likely the pharmacy spend will go up, but it's more than offset by the savings on the medical side. Now recall, our medication synchronization tool uses an appointment-based model, which incorporates direct and indirect communications along with the coordination of the prescription refill dates. And we believe it's this compilation of functions that yield the improvement. Next slide, please. Oh, there you go. So let's take a quick look at process. Here's an illustration of data ingestion and processing, which takes place within our patient engagement platform that we looked at a few minutes ago, and member or patient communication vehicles that are driven through EnlivenHealth's omnichannel communications platform. Now, speaking of data, let me quickly mention one area where I think big data will be assuming a more prominent role in healthcare. And that's where it will enable predictive analytics to drive preventive care. Now, predictive analytics is a subset of artificial intelligence that uses statistical algorithms combined with internal and external data to forecast future trends. But to drive accurate forecasts, tremendous amounts of data and computing power are required. Hence, one of the reasons we're seeing an exponential growth in cloud computing. Now, on that note, let me make a quick comment about the COVID pandemic and its impact on predictive analytics. By all accounts, this was an external disruptive event that turned the global economy upside down. Supply chain predictive analytics couldn't account for the global impact caused by COVID. Consequently, one of the factors contributing to our current supply chain problems comes from data that is skewing our predictive tools. So you may be experiencing forecasting challenges within your own organizations, but you're not alone. Businesses across the entire spectrum are struggling with forecasting because of the anomalous consumer behavior due to COVID. Consequently, there's considerable debate over the inclusion of the 2020 data in predictive models. In fact, CMS recognized the data aberration caused by COVID and announced it would be making some allowances for that aberration in calculating STAR scores. Now, we will always have events that tend to skew data, but rule of thumb is the more data that you include in your analysis, the more accurate your forecast will be. Now, as an example of predictive analytics in healthcare, the University of Pittsburgh Medical Center is using data analytics to provide a broad view of clinical, financial, payer, and genomic information. And according to UPMC, they are using analytics to proactively manage care and keep their patients out of the hospital. And UPMC's CIO attributes their success to the use of predictive analytics. Now, the important points I want to make on this slide are copious amounts of data are better. Secondly, predictive analysis can be used to improve member health. Third, the data to be processed such that an accurate, personalized communication can be delivered to the member. And fourth, in order to have broad appeal to members, an effective engagement tool needs to support a variety of communication methods to accommodate member preferences. All of the communication methods that you see listed here are available on a cell phone. And to show you just how that translates to member engagement, let's take a look at a few data points on that. Next slide, please. Now, cell phones have become ubiquitous. 97% of Americans own a cell phone, and 85% of us own a smartphone. Text messaging is available on any mobile device and is used by all socioeconomic groups and ages. Furthermore, it's the most commonly used function on cell phones behind telephones. In a meta-analysis of mobile text messaging published by the University of North Carolina in 2018, it was reported that text messaging doubled the odds of medication adherence and improved overall adherence rates by nearly 18%. Now, as an example of the impact of text messaging, in 2016, an Arizona-based plan decided to use a targeted text messaging campaign to improve certain HEDIS scores. And after the first year, they observed a remarkable increase in the HEDIS measure for well child visits. And what they said was, text messaging enabled us to contact thousands of members at once without compromising our ability to tailor messaging based on specific populations, and we saved a tremendous amount of time while increasing our HEDIS measures. Now, that same initiative delivered an unexpected dividend to that health plan. The plan was able to take advantage of on-demand messaging to distribute urgent messages at scale in areas affected by natural disasters or other unexpected scenarios such as a pandemic. Now, putting my attorney hat on for just a moment, I'll add one precautionary comment here regarding regulatory compliance. The Telephone Consumer Protection Act, or TCPA, governs these communications and is administered by the FCC. And failure to abide by the TCPA could result in costly fines. So be sure to engage a communications vendor who is well-versed in TCPA compliance. Probably more important, when you're striving to improve customer satisfaction and loyalty, you want to be sure you're sending the most relevant messages to willing members. Now, think of this approach as a vehicle to deliver a wide variety of member communications. Next slide, please. Now, the list for uses for digital member communications is limitless. Here are just a few suggestions where digital communications could be useful. And by the way, fit nicely into the basket of valuable communications identified by the J.D. Power Survey as clear, helpful, and proactive. But keep in mind, one of your primary goals is to create positive member experiences. Member churn yields revenue loss. Now, it's much less costly to retain existing members than it is to win new ones. Some studies show it's 5 times more expensive to attract new customers or members than it is to retain existing ones. Higher retention drives growth. Now, within your membership, you not only have a variety of communication preferences, but you likely have a broad spectrum of communication opportunities dictated by the individual's health records. Now, consequently, applying tailored algorithms during the data processing phase allows you to direct the appropriate communications to members, which then appear to the member as being personalized. Now, when considering your member communications plan, it's also important to consider its scalability. As your customer base grows, you need a communications platform that will allow you to add customers with ease and without incurring excessive expense. It's important that your communications channels keep pace with your customer growth. Similarly, you may find the need to communicate with members or patients more frequently. The COVID pandemic accelerated the pace of health plan communications. Many plans found themselves educating members about symptoms of COVID, the availability of telehealth, the need for vaccines, testing options, etc. So when you consider this increased communications volume, the cost of analog communication channels often becomes prohibitive. However, with digital communications, you can easily incorporate new customers into your communications plan. Now, using data science, behavioral research, and omnichannel tools, you can quickly and inexpensively tailor your communications content and connect with customers and move them to take action at scale. So, expansion is a very important consideration. Next slide, please. Now, there is a large body of evidence substantiating the notion that digital communications, in particular text messaging programs, can positively impact patient behavior to improve short and long-term outcomes. That's been shown to improve treatment compliance, including medication adherence and appointment attendance, vaccination rates, reducing risky behavior related to HIV transmission, and improving health knowledge. Furthermore, it's an automated technology that can operate in a secure environment, yield high participation rates, perform in real time, be tailored to member-specific situations, and conform to the appropriate level of health literacy and cultural considerations, all without requiring an app to be downloaded or another password to be entered. Now, to give you a sense of how these interactions would look to a member, here's an example of a health risk assessment engagement. And as you can see, the engagement is on the member's cell phone. It's very convenient for the member, it's easy to use, and it can provide a great deal of information in a short time. So you might say, well, yes, but how likely are members to engage? Well, let me just show you some data on that too. So next slide, please. So here's a situation where a Medicare Advantage plan affiliated with a large IDN struggled to engage members to complete health risk assessments ahead of annual wellness visits. Attempts to engage members via paper mail, outbound phone calls, and portal-based strategies had generated less than 5% completion. Pathetic results. And outbound calls, by the way, from the plan's contact center were costly and very difficult to scale. So the plan decided to try a texting campaign. And as you can see, the texting campaign delivered some remarkable results. Half of the members contacted began a conversation, and 96% of those folks completed the assessment, a 10-fold improvement over the plan's baseline rate. Further, 80% of the members said they preferred this method over others. So at least in this case, this texting campaign satisfied some important goals. It showed a very good adoption and completion rate and a very good member experience. And undoubtedly, the plan benefited from the data the campaign was able to gather from the participating members. Now, while this example is dealing with an HRA campaign, the method can be easily adapted to other uses, such as a CAHPS survey preview. And in that case, I would use the campaign to measure members' opinion throughout the plan year so that the health plan might adjust its member engagement initiatives to deliver the best results, which would then be ultimately captured in the actual CAHPS survey. Now, the widespread deployment of cell phones and increasing adoption of text messaging across virtually all population segments will continue to be an excellent vehicle to deliver health campaigns. Next slide, please. As I mentioned earlier, a program needs to track, measure, and report on the intervention activity. So here's a snapshot of one of our dashboards that would be used with a health risk assessment campaign. And as you see, it's a concise view of the key performance indicators associated with the campaign, and it can be tailored to the individual campaign itself. For instance, if we wanted to launch a campaign dealing with CAHPS measures, we would merely frame the questions accordingly, then capture the program data elements and report them on a dashboard similar to this one. And by the way, all of the data behind our dashboards is provided back to the health plan so that the appropriate action can be taken by the plan. And once again, it's very important to monitor and measure the progress of your program. If you aren't doing those things, you can't effectively manage it. Next slide, please. So just to quickly conclude, if you're striving to improve your members' experience while improving their health, consider an integrated program that contemplates both. And in that regard, medication adherence and thoughtful member communications are ideal areas to focus on. In doing so, you can influence two of the most important quality measures. Now, it's well documented that improving adherence to chronic medication regimen yields clinical and financial dividends. In addition, an effective member communication plan will boost medication adherence rates and improve member retention, experience, and satisfaction. So thank you for your kind attention. And Lauren, with that, I'll turn it back to you to see if we have any questions.
Excellent. Thank you, Mike. We do have quite a few questions that have come in throughout the presentation. If you do have a question, please, it's not too late. Please submit that through the Q&A function there at the bottom of our screen. But we'll start broad here, Mike. So what are the opportunities for pharmacies and plans to work together to enhance member and patient experience?
I love that question. So I see a number of places in the care delivery model where plans and pharmacies might collaborate. You know, just as I discussed, those members or patients who aren't adherent to their care plan is an obvious opportunity. Now, on top of the frequent patient encounters at the pharmacy that I mentioned, pharmacists, at least according to the Gallup poll, are consistently among the most trusted professionals. And I think pharmacists could better leverage those frequent patient encounters and their position of trust to learn more about the reasons why a patient isn't adherent. Now, the challenge for the pharmacist is learning which patients they should be spending more time with. They don't have enough time to allocate, extended amounts of time with every patient. So that's where the health plans can help by identifying those members who they would like the pharmacist to intervene with. And another area, I think, where a collaborative approach would be beneficial is in coordinating member or patient communications. For instance, if the plan has a texting campaign that's focused on improving medication adherence, it might be helpful to include verbiage in the text message that encourages the member to talk to their pharmacist. And from a financial model perspective, and in keeping with a value-based delivery model, I'm a proponent of a pay-for-performance construct where the pharmacy is compensated for achievement of predefined goals. That way, the financial risk to the plan is mitigated, yet the pharmacy is rewarded for achievement. Hope that.
Excellent. And somewhat of a follow-up to that. So is this platform geared for more health plans to implement versus pharmacies? So who initiates and manages those member communications?
So they can be initiated and managed either at a health plan or at the pharmacy. So the platform can support data regardless of the data source. So like I say, we ingest data from health plans, we ingest data from pharmacies, and the communications plan, and maybe I ought to separate it into a medication synchronization initiative versus a communications initiative. The communications initiatives can be supported through either channel, that is the health plan or the pharmacies. The adherence by way of medication synchronization programs are typically administered through the pharmacies.
Excellent. And so continuing down our list here, so Mike, you mentioned when talking about plans and pharmacies working together that plans and pharmacies could better understand why adherence might not be high. And so this next question relates to the different populations and potential reasons as to why adherence is not where it should be. So how have you used this system and this engagement platform with dual special needs populations? So did you see an increase in compliance for patients who resided in poor, underserved communities?
Great question. So I don't have data specifically on that. I can tell you, though, that we are actively pursuing incorporation of social determinants of health data, into our analytics tool to hopefully shed some light on that, because I think that's an extremely interesting component, of healthcare. And hopefully then we'll be able to actually identify some unique needs to specific patient populations to then prescribe interventions that are really tailored to that group. So, but I don't have any specific data to share with you today.
Excellent. So continuing on here, so with we have about 7 minutes left in our question and answers here. So keep the questions coming in from our audience. All right, Mike, the next one up here. Are there any strategies to effectively utilize 90-day supply fills to improve adherence metrics / PDC compared to the 30-day supplies? Are there any reimbursement considerations related to each of these?
Good question. So once again, I'm a proponent of 90-day supplies. I was a proponent of it when I was working for Pharmacies too, because it definitely drives up adherence. So that's actually a great question, and we actually do have a solution that actually does comb through the dispensing data, identify prescriptions that have been historically dispensed at 30-day supplies, and identify those as opportunities for a 90-day supply. As far as the cost implications, it's interesting. So, and that's where close collaboration between the pharmacy and the plan is important, because sometimes patients will reject a 90-day supply at retail if the copay is going to be a multiple of a 30-day supply copay. So something to be considered there. But yes, we can absolutely identify prescriptions that are good candidates for 90-day supplies that have historically been dispensed as 30-day supplies, and they do tend to improve adherence scores.
Excellent. So you mentioned the engagement platform and the HRA campaign. So in that mobile campaign, how likely are members to engage annually with a campaign like that? So any results to share about the continued engagement year over year?
So I don't have a follow-up to that plan that I revealed the data on. I don't know what happened, in subsequent years. That would be an interesting thing to look at. But like I said, what we have seen from our own internal data is that if you take prompts away from folks, they tend to revert. But on the other hand, if you over communicate with people, they tend to ignore it. So I think it's important, to carefully measure what the volume of your communications look like out to the members. You don't want to make them essentially numb, to your contact points. So important to, I think, stay in front of the member, make the member aware that you're there to help them, but don't inundate them with communications.
So continuing on here, so from a medication adherence perspective, how have you, what's your experience been with working with independent versus the large retail pharmacies? Has that differed at all? Are there any challenges unique to one versus the other? And then how do you advise our payers to, as part of the audience here, how do you advise those payers to navigate that?
So the independents versus the chains, no, I really haven't seen much difference one way or the other. The independent labor model is a little bit more conducive to more time with patients, but that doesn't mean that the chains haven't been very successful, in allocating time to. Once again, what our solutions strive to do is to free pharmacists up and provide them with the targeted list. And therein lies the connection between the health plans and the pharmacies. When the health plans identify to us at EnlivenHealth patients or categories of patients that they would like to target, that we then will analyze the data associated with those members and then make that information available to the pharmacies so that they know exactly which patients to engage. So, like I say, doesn't really, I really haven't seen a difference between independent activity and chain pharmacy activity. It's a good question.
So related to that patient engagement and kind of the many different patients that are out there that you just described. So do you see an off benefit cash or discount card prescriptions impacting the Medicare adherence star ratings?
Yeah, that's a great question. So, well, certainly cost is one of the factors that influences medication adherence. So, when you're talking about patients who are frequently on fixed incomes with multiple prescriptions, certainly it becomes a bigger issue than maybe within a younger cohort. So yeah, I would say that you're right that the cash discount cards definitely can have an impact on adherence, and how that translates to Medicare measures becomes even a more interesting conversation, assuming that those transactions aren't finding their way back into the plan's data, which ultimately gets reported back into CMS. So that's definitely an interesting topic to explore, and I think something that industry would be well positioned to have a very meaningful conversation across a variety of stakeholders. Because that's, to me, that's something that needs to be solved, and I think there's some relatively easy solutions available to us for that.
So you mentioned the Enliven platform is able to identify those candidates that are 30-day fills currently and switching them over to the 90-day fills. Is there, can the platform further track and solve for the kind of the foot traffic or the decreased foot traffic element that comes with that 30 to 90-day transition?
Yeah, that's a great question. So our platform can't. So we don't see it. We only see, essentially the pharmacy data or the health plan data. So I don't see door traffic data. I do know this, though, that there actually have been some studies on that point recently, and the studies that I've seen on that is that the 90-day fills don't necessarily decrease foot traffic to the pharmacy. Folks go to the pharmacy for more reasons than just to pick up their prescription, so it doesn't necessarily implicate that. I have spent some time too with combination grocery and pharmacy operators, and certainly we talked about it frequently there. And as you know, I mean, folks go to the grocery store just about every week, regardless of whether they're picking up a prescription. So foot traffic doesn't typically go down when you're talking about 90-day fills. And by the way, I had the same. We did just an informal survey on our own when I was at just a pure standalone drug chain to see if we noticed any sort of an effect as our 90-day fill volume was going up. We did not see any decrease in our foot traffic through the front doors.
So in conversations that PQA has been having with a number of our different pharmacy partners, we've seen that a lot of our pharmacies are focused on different priorities. Some have prioritized immunizations and pursuing those opportunities higher, versus looking at A1C and blood pressure and looking at those. So all that to say that our pharmacy partners have some different priorities. And so are those pharmacy partners able to customize their patient communications based on those priorities? And then would the pharmacy be able to track those responses based on those priorities?
Oh, absolutely. The communications, that's one of the nice things, about digital communications, is very easy to tailor the communication. So if you want to send out a COVID vaccine campaign, that's easy. And if you want to send out, a hypertensive campaign, those communications are very easy. And in fact, this is where I think some neat things are being developed. So you can include a link in your communication if you want. If you want to take a patient, say, for example, to to a demonstration of how to properly use their inhaler, or the importance of adhering to their antihypertensive medications and things like that. You can actually embed a link in the text communication, for the member or the patient, to hit a more in-depth educational component.
Excellent. So Mike, we're here at the final 3 minutes of our presentation, and I want to give you an opportunity to leave us with some takeaways. So what's your final message for us and our audience here?
Well, Lauren, I'll just go back to kind of what I mentioned earlier, and that is medication adherence and thoughtful member engagement campaigns are excellent areas to focus your attention on. In doing so, you can influence two of the most important quality measures while boosting member health.
Excellent. Excellent. Well,